Welcome. We're here again with Dr. Mehta to do our Eye on Vision segment. And Dr. Mehta, we have some more questions for you today that were sent in on social media. And I'm going to put my glasses on now so I can actually read them. So Debbie asks, my retina detached twice in my right eye. The first time I had the gas bubble in my eye. I had to keep my face down for many, many weeks. The second time, the doctor put in silicone oil in my right eye. The silicone oil is still in. It's been 7.5 years. Is this unusual to you? The doctor does not want to remove it because I might lose more of my retina. What is your opinion on this?
It's an excellent question, and I certainly have a lot of patients like Debbie, so thanks for the question. So what ends up happening with retinal detachments is that often after we fix them, they can redetach, and it's because it's such a thin, fragile membrane in the back of the eye. So another tear or scar tissue can redetach the retina. And often if it detaches a second time, we'll place silicone oil in the eye just to make sure that we're giving it the best chance of success, because the silicone oil, unlike a gas bubble, doesn't go away. It stays in there until we take it out. And that gives the retina some extra support, to keep it reattached. Now, often in very severe detachments, we end up leaving the oil in because we're afraid that if we take out the oil, the retina will redetach. And the more the retina redetaches, the less likely you're going to gain any vision back, and you could lose the vision and the eye entirely. So it's probably best to leave the oil in certain circumstances, and certainly if your retina specialist feels that way, it's probably the best choice for you to at least maintain some level of vision in the eye.
Okay, well, thank you. Now, Cindy asks, are children at risk for retinal diseases? If so, what retina conditions are common among children, and how would I notice if my child was having retina problems?
Okay, another really good question, Cindy, and I will tell you that children are predisposed to some retinal conditions. Often, it's not that common, but we can see it affect either the peripheral vision or the central vision. There are various conditions. Often, children don't even know that their vision is impaired because they grow up thinking, okay, this is the way they perceive the world. This is just the way the world's supposed to be. So they don't even realize that their vision's impaired until perhaps either they get an eye exam or the parent or some teacher or somebody notices that their eyes start to drift a little bit. So often it's referred to as a lazy eye, or amblyopia is the term that we use. And basically what ends up happening is one of the eyes, if it's weaker than the other eye, can deviate and move outward or inward. It doesn't align properly with what the child is trying to focus on. And so that often can indicate that there is either retinal disease or some other type of ocular disease in the child that's impairing the vision.
So could that be like maybe a teacher would notice it through their homework?
Yeah, either homework or, they do vision screenings at school every year, so they can pick up on it that way. Often, like I said, as the parent, you're looking for the eye deviating in any way. And you're also looking for, let's say, for example, you take a picture of your child and you see a white pupil, rather than often you'll see that red reflex, with the camera. But if you see a white pupil, that could indicate a problem in the back of the eye. There are several different conditions, including tumors, that can cause that. So if you ever take a picture of your child and you see a white pupil reflecting back at you, definitely get that checked out.
Yeah, that's good. Now, Robert asks, what are cotton wool spots and what causes them?
Yeah, cotton wool spots. So they're in the retina, and there's a specific layer of the retina called the nerve fiber layer that they rest in. And basically what they represent are areas of poor or absent blood flow in the back of the eye. So the most common causes of cotton wool spots are going to be diabetes and hypertension or high blood pressure. Cotton wool spots usually in and of themselves don't cause vision loss, but they are a hallmark that, basically it's an indication that the diabetes or the high blood pressure is not under good control, and ultimately that can lead to further loss of blood flow. That can ultimately affect the vision, but the cotton wool spots are more of a sign telling us as the retina specialist or the ophthalmologist that the blood sugar and the blood pressure is not under good control.
Okay. Melanie asks, which eye health vitamins would you recommend? There are many on the market, and I was wondering if there were any significant differences.
Okay, good question. You know, we get this question a lot as retina specialists because we deal with a condition called macular degeneration. Very, very common. It affects a lot of people, especially over the age of 65. That is really the only indication for eye health or vitamins for the eyes specifically. A lot of people think, oh, I've had a retinal detachment or I've had some sort of bleed or a ruptured blood vessel, they should be taking vitamins for their eyes. Well, we have no indication or no level 1 evidence to support their use in the treatment of other conditions. But for macular degeneration, definitely. Now, if you're taking vitamins for macular degeneration, you have to make sure that you're taking the AREDS2 formula. It's AREDS2. It basically has certain minerals and vitamins in the multivitamin that's going to decrease the risk of progression of the macular degeneration and ultimately, hopefully, stabilize the eye. Now, nothing's 100% with macular degeneration, and even patients that use their vitamins diligently or take their vitamins diligently still end up getting progression of macular degeneration. But at least it's something that we can offer to these patients.
Okay, good to know. And Jill asks, my husband detached his retina years ago before there were better technologies in place. They repaired it, but it creates a wave in his vision, and he's legally blind in that eye. Are there any new treatments?
So that's a good question also, and I'll tell you that it depends on how large his retinal detachment was. I'll tell you that the large retinal detachments, even if we successfully fix them, there will be a bend or a wave to the vision that's permanent. Now, if his retina is redetached, then obviously we can go back in and fix that. But there's no new treatment or technology that's going to make that bend or wave go away if the previous detachment was large enough to affect the very center of the retina or the macula. Unfortunately, he's stuck with that until we figure out a way to successfully transplant retinal tissue in the back of the eye, which may happen one of these days, but not anytime soon, unfortunately.
Oh, very interesting. If you have any questions about retina disease, please submit them to communications@retinalconsultantsaz.com or call 928-855-5026. Thank you again, Dr. Mehta.
Well,
you
thanks for having me. I really
information.
appreciate it. It's really a pleasure for me to do this, and I love to reach out to the Lake Havasu community. And if there are any more questions, please submit them to Facebook. Be happy to answer them anytime.
We enjoy having you. Thank you.